Well, similarly, I have a question submitted before that I was just diagnosed with stage 2 colon cancer, and I'm having a difficult time deciding whether or not to have chemotherapy. Can KRAS, Oncotype, or MMR help me with this decision? So these are all molecular biology tests today, but they're a little bit of different purposes. So the test for KRAS has no usefulness in this situation for stage 2. KRAS testing is really only helpful in deciding if using a certain drug or certain class of drugs is helpful or not in stage 4 colon cancer. It doesn't help predict if the cancer is going to come back or not. So that's not helpful here. Oncotype, we already discussed, it gives the doctor a score that tells him or her what your chance of the cancer coming back is going to be, and that would help guide a discussion with you how much benefit chemotherapy might have. So that could be helpful. And the final thing is MMR. So MMR is mismatch repair enzymes. What that means is that, just to explain that a little bit, so when I grew up and we first learned about DNA, they kind of described this double helix, and everybody thought that the DNA is just kind of in this structure and doesn't do too much. But actually the DNA is very active. It's always undergoing opening and closing and directing the cell what to do. So in all this DNA translation and transcription, the DNA opens and closes and mistakes happen in the DNA. So you get like spelling errors. So mismatch repair enzymes are like the spell checkers for your DNA, and they come along, and if they find that one of the DNA bases is wrong and there's a spelling and there's a typo in your DNA, it can fix that typo. It takes out a base and puts in a new base. So when you have that, that's good because it helps you from helps prevent the DNA from having mutations that can cause cancer. These mismatch repair enzymes happen to be very, very important for the colon because apparently when you eat, you maybe get exposed to more things that can cause DNA damage and spelling errors. So if people have an inherited defect in mismatch repair enzymes and they don't have all the normal mismatch repair enzymes, then they are more likely to get colon cancer. And that is a condition called HNPCC, hereditary non-polyposis colon cancer, or Lynch syndrome. When people inherit a genetic defect in their mismatch repair, they are more likely to get colon cancer. But people who have mismatch repair enzyme are also more likely to be cured by surgery alone, and chemotherapy isn't often necessary, especially in stage 2. So in short, so that's a long answer. So MMR can be helpful for stage 2 to tell you you don't need chemotherapy, and the Oncotype can be helpful in telling you what your chance of the cancer coming back is so that you and your doctor can have a discussion about the potential benefit of giving additional chemotherapy.